How do you defend the world against Ebola? It starts with more help for West Africa. The worst affected communities lack the basics: adequate protective clothing, trained medical staff and laboratory facilities. The World Health Organization says only international support will bring the outbreak under control.
This is an infectious disease which can be contained. It is not mysterious. This is something which can be stopped. This depends on identifying everybody who has an Ebola infection and making sure that they receive the right treatment and making sure that we stop the chain of transmission.
Ebola is a viral infection which originates in animals such as bats and chimpanzees. It spreads between humans through direct contact with blood and other bodily fluids. The virus has an incubation period of up to 21 days, and the death rate is alarming. More than half of those infected have died. Fortunately, Ebola is not very contagious. Pneumonia, an airborne infection, kills 3,000 children a day, more than Ebola has in 40 years, as do other diseases.
The numbers of people who've died so far in this epidemic, or perhaps ever from Ebola, are dwarfed by the numbers who die from tuberculosis every day, for example. So the numbers are small, but the potential for an outbreak like this to go out of control and to spread, and the numbers really to ramp up, is truly frightening.
The threat to countries like Britain remains low. Even if Ebola did come here via a sick air passenger, health officials are confident they could contain it using isolation facilities like these.